Good evening, ladies and gentlemen. My name is Stephen Crowley. Today I'm here to talk to you about the VA healthcare system and then the problems that they are currently facing. So why does this matter? The reason it matters is patients are not being treated properly, they're being exposed to a dangerous healthcare environment, and they're being misdiagnosed by unqualified healthcare professionals. So why is this important to me? In 2017, I had a patient that came to me in the ER. He told me the hardships that he was facing in order to get an appointment with his healthcare provider for his diabetes. It took him 4 months to get an appointment. Unfortunately, he actually never received an appointment. The only way he was treated was if he came to the ER. He told me a story. He called for his yearly checkup to speak to the physician to get his yearly checkup for his diabetes. They told him to call back at a later time. We don't have any slots available. The next time he called, they said the same thing. We have no slots available. Please call back at a later date. Unfortunately, that later date never came. The only way he was able to see a doctor was if he admitted himself into the ER. And that's where I came across him, and he told me about his story. This is completely unspeakable how this could happen to a veteran in our society today. So what could have went wrong? According to diabetes.org, diabetes is the 7th leading cause of death. 79,535 people die every year from diabetes. This man could have ran out of medication. He could have been experiencing problems with circulation to his limbs, which would have led to amputation. 73,000 people suffer from lower extremity amputation every single year. So what is the VA healthcare system? The VA healthcare system is the largest integrated healthcare system in the United States of America. It has 1,243 facilities, and they treat 9 million veterans every single year. That number of 9 million is currently growing at a rapid pace. So what's the problem? The biggest problem currently is patient wait times. Patients are experiencing extremely long wait times from weeks to months to even years in extreme cases. Patients are not being treated properly, and the VA lacks the personnel and capability to treat these patients in a safe and effective manner. So this is a picture that I took 2 days ago. This is examples of the wait times of these facilities. This is just New Jersey. So East Orange is 22 days, Jersey City is 18 days, Morristown is 20 days, and then if you see down here, Burlington County is at 50 days. So the average time that you wait to see a regular private care doctor would be about 7 to 10 days. If you take a look at these numbers, 22, 18, 20, and even 50 days to wait to see a provider is completely unacceptable. So what's the difference between the VA and private care? So in the VA healthcare system, if you live within a 75-mile radius of a VA healthcare hospital, you are required to go see them. If you choose to go see another private care doctor and you live within that 75-mile radius, you will not be covered under their health insurance. Instead of being able to easily pick up the phone and place an appointment with a private care doctor, you will have to wait weeks, months, possibly years to be able to see a doctor and get the care that you need. This is creating a backup and a hectic work environment. This hectic work environment is being taken out on the patients. For example, when a patient comes in, the doctors are trying to get them in and get them out so they can take care of the patients and dwindle down the patient load. The effect on the veterans. According to Art Levine of the New York Times, veterans were twice as likely to die from an opioid overdose in 2011. So why do you think this is happening? Due to the overwork of the VA healthcare professionals and the long list of patients that are waiting, doctors are pushing them in, pushing them out. When this happens, they are just randomly prescribing patients medication in order to get them out the door. This creates veterans to become addicted to opioids, and that's what led to them being twice as likely to die of an opioid overdose than a civilian. In another study, the VA is accused of incompetence. 18 veterans were committing suicide every single day, which was twice the national average. If you think about it, 9 million veterans consist in the VA system. The general population is extremely high, way higher than 9 million, and they were still committing suicide at twice higher rate than the general population was. Once again, why do you think this is happening? Mental health professionals are unable to see their patients in an effective manner because of the long wait list due to the infrastructure and technicality failure of the VA healthcare system. Not only does this information reveal that the doctors are not able to properly care for their patients, but they're unable to safely and effectively treat their patients.